Hello everyone, welcome back to the channel. I hope you got most, if not all, of your holiday shopping done and you're able to relax before the big day. My fiance is actually out right now doing some last minute holiday shopping. So today I want to talk about an important topic in mental health care, ethics and mental health counseling. Ethics are the guidelines that help to ensure counseling is safe, respectful, and focused on the well-being of the client. Ethics protect the person seeking care and the professional providing it. So having an understanding will actually help to promote trust and healthier outcomes. Right now I'd like to switch gears because I created a PowerPoint presentation that I want everybody to check out. I'm very proud of it. So let's take a look. Welcome to this presentation on ethical standards in mental health counseling. Today we will examine the core principles that guide professional practice, which would include confidentiality, boundaries, competence, informed consent, and of course, cultural sensitivity. It's a very base level and fundamental PowerPoint presentation, but it's also a must to have this level of understanding for any ethics exam you'll be taking. In the near future, I plan on posting a deep dive of each core principle separately. An understanding of these ethical standards is really essential for both safeguarding clients and maintaining professional integrity. Okay, so ethical standards provide counselors with a framework to make decisions in complex clinical situations. As you know, professional codes such as the ACA and APA ethics codes, they establish these standards and define the responsibilities of counselors towards clients, colleagues, and society. So the question is, how do they differ? Well, APA is more general, and the ACA has detailed guidelines. I think in the future, I will be putting together a PowerPoint presentation on more specific differences. But one specific difference is ACA requires clear contracts for bartering and specific fee collection plans, which APA addresses completely differently. One of the main core principles, trust and rapport, are really foundational in mental health counseling. And so if we're logical about this principle, right, this is one of the simplest to understand. I'm sure you guys will agree. The client deserves patience, genuineness, authenticity, and active listening. As we move through the PowerPoint, you're going to see how trust and rapport are seamlessly connected to every principle, actually. And ethical adherence ensures accountability, reduces risk of harm, it supports evidence-based practices, and ethical guidelines also help counselors integrate culturally competent approaches into treatment, ensuring equitable care. All right, now we're going to talk about confidentiality and how fundamental it is and effective for counseling. Clients must trust that personal information is secure. Counselors also need to clarify the legal and ethical limits of confidentiality, like, for example, mandated reporting requirements. There are legal limits to this in situations such as suspected abuse, immediate danger to self, and duty to harm. Of the 7 golden rules to information sharing, one that is coming to mind now is document, document, document. You must keep a record of your decision and the reason behind it. Okay, so professional boundaries ensure that the counselor-client relationship remains therapeutic rather than personal. Avoiding dual relationships prevents ethical conflicts and protects both the client and the counselor. The focus has to remain on the client, guys. That means as a counselor, self-disclosure should be minimal and non-specific. It's the counselor's duty to set boundaries, and the adherence to these are a must. Counselors must practice within the limits of their competence and continually engage in professional development. You have to know what you know and know what you don't know. Instill it in your head to always stay in your scope. Ethical responsibility also requires referrals when client needs exceed the counselor's expertise. This will ensure a high quality of care. Informed consent is a cornerstone of ethical practice. Clients must understand the counseling process and their rights. So the client needs to know what to expect from the counselor in the office. That being said, informed consent has to be tailored to your practice and the services you provide. So this transparency will foster autonomy and facilitates collaborative treatment planning. Cultural competence is essential for ethical counseling, and counselors must be aware of their own biases and work to provide inclusive, affirming care. So it's critical to apply knowledge to adjust communication styles, approaches, and treatment plans to fit the client. Ethical practice requires respecting client diversity to promote equitable mental health outcomes. Beneficence and nonmaleficence are foundational ethical principles. Beneficence can come in many forms like prevention, early intervention, which benefit the client. This is always the main goal. Non-maleficence is baseline in life and crucial as a counselor. Do no harm to others. Avoid and stay away from risky behaviors and situations. Counselors must ensure that all actions and decisions prioritize client welfare and avoid causing harm, even unintentionally. Ethical standards protect clients by ensuring their rights are respected and giving them guidance in the counseling process and confidence. It's important to take note of how adhering to ethical standards makes for an effective and respectful client counselor relationship. These standards also promote accountability and professional integrity. So, in summary, ethics are essential for effective mental health counseling. Adhering to these standards ensures safe, professional, and client centered care, which will enhance both outcomes and trust in the profession. Take heed when a desire to follow your intuitive direction comes in. Following the ethical standard is the right path to take for your client. So right here, I've listed out references for further reading and understanding of ethical standards in counseling. Some are foundational texts, and a good portion are professional code of ethics that guide clinical practice. Some key takeaways from the PowerPoint presentation are the ethics are the foundation of effective mental health counseling. They help to promote trust, accountability, care, and help to create a safe space for people to seek support without fear or judgment. In the next few days, I'm going to be posting over 10 case scenarios with relevant questions and answers to tie everything together. Thank you so much for watching and for being a part of a community that values ethical mental health practices. If you found this video helpful, feel free to like, share, and subscribe for more educational content. I hope you all have an amazing holiday and that you have time for self-care as well. That's all for now, but not forever. Ciao. Arrivederci.